Improvement in cervical cancer screening seen through improving reminders for physicians on Epic EMR. Cervical cancer is crucial because it significantly reduces the incidence and mortality associated with cervical cancer. Screening methods such as Pap test and HPV testing can detect precancerous lesions in early stage cancers, allowing for timely intervention and treatment. The American Cancer Society emphasizes early detection through screening can prevent the progression of precancerous lesions to advanced cancer, thereby reducing the burden of disease. Additionally, the American College of Physicians notes that identifying and treating cervical intraepithelial neoplasm lesions through screening leads to reduction in cervical cancer incidence, morbidity, and mortality. Regular screening is particularly important because it can identify treatable abnormalities before they develop into cancer. Thus playing a vital role in secondary prevention. Furthermore, population-based studies, such as those conducted in Taiwan, have demonstrated that regular pap smear screenings can lead to significant reduction in cervical cancer deaths, with high compliance rates resulting in up to 80% reduction in mortality. Overall, pap smears are a critical tool in early detection and prevention of cervical cancer, contributing to improved survival rates and reduced disease burden. OSU Family Medicine uses Epic EMR as a tool to remind us about these very important preventative healthcare needs. One of those tools is the patient care coordination note. AIM statement: the patient care coordination note already includes other cancer screening reminders such as colon cancer and breast cancer. This quality improvement project aimed to determine if adding cervical cancer screening to the note would lead to a change in the number of cervical cancer screening appointments scheduled at our clinic. Duration was between January 1st, 2025 to April 31st, 2025. Our goal is to increase the number of cervical cancer screening appointments scheduled at the 3 clinics: OSU HCC, OSU Eastgate, and OSU Legacy. Cervical cancer screening was added to the coordination care note on January 1st for 3 clinics. The note was updated whenever a patient was checked in. Providers updated the care note as they see fit in whatever fashion they normally do. Data was pulled from clinical records to see encounters for pap smears from January to March as a control. This is a time period when there was not a cervical cancer screening in the coordination care note. Data was pulled from clinical records to see encounters for pap smears during this time period in which cervical cancer screenings appeared on the note. For all encounters, data was compared between 2 time frames for total encounters that involve pap smears, encounters between clinic locations, and encounter types such as completed, no-show, left without seeing, canceled, and scheduled. Since no patients identifying data is used, the project is IRB exempt. Just going through some osteopathic considerations. From an osteopathic perspective, cervical cancer screening aligns with the tenets of whole person, disease prevention, and integration of body, mind, and spirit and patient health. Osteopathic physicians emphasize the importance of preventative medicine and patient education, making regular screening a vital part of promoting wellness and mitigating future disease. By utilizing tools such as the patient care coordination note within the Epic EMR, OSU Family Medicine supports the osteopathic principle of whole person care. These reminders help to focus on all aspects of patient care and not just the present illness. These EMR-driven reminders facilitate proactive conversations between physicians and patients, helping address barriers to care such as access to fear or misinformation, and ensuring screenings are not overlooked. Cervical cancer disproportionately affects underserved and vulnerable populations. Osteopathic medicine's commitment to social responsibility and advocacy for equitable healthcare reinforces the importance of ensuring that all patients are reached through consistent, compassionate, and culturally confident outreach. Incorporating osteopathic principles into routine preventative care, includes cervical cancer screenings, allows for a more holistic and patient-centered approach, ultimately improving healthcare outcomes. So here are our results. So there was a total of 342 pap smears scheduled in 2024 versus 452 scheduled in 2025. So we had a 32% increase in the number of pap smears that were scheduled during that time period. As you see here in the graph, we had 181 completed pap smears in 2024 during this time frame and 186 completed in 2025. So 2% increase there. Increase seen in all encounter types, including completed, canceled, no-shows, left without seen, and scheduled. January through March pap smears increased in all clinic locations where new care coordination notes was implemented. Range of increase in clinic locations from 10% to 150% from 10% at the Legacy Clinic and to 154% at the Eastgate Clinic. Here we have by clinic location showing how much it increased per clinic location. And then we have by type of encounter. Showing that the most common was completed and canceled. In conclusion, since the inclusion of cervical cancer screening to the coordination care note, the total number of pap smears scheduled from January through March in 2024 compared to 2025 increased by 32%. This shows a positive correlation between the addition of cervical cancer screening in the patient care coordination note and the number of pap smears scheduled. A smaller increase was seen in the increase of completed pap smears. However, the increase is seen across all encounter types, including canceled and no-shows, which provides more opportunity to be scheduled at a later date. The increasing number of scheduled pap smears can also be seen across all tested clinic locations. The aim of this project was to improve the number of cervical cancer screening appointments, which it was successful in doing. One significant limitation of the project was the short time frame of data collection. A longer time frame could potentially allow for patients who rescheduled to demonstrate more completed pap smears. The next step for this project will be to continue to include cervical cancer screening in the coordination care note. Further data collection can compare year-long differences between 2024 and 2025 to see if the trend that was seen in this project continues with more scheduled pap smears, as well as if there is more significant increase in the number of pap smears completed. Further projects could also investigate if more cases of cervical cancer are caught and implications on mortality. This process can also be easily implemented in other clinic sites that perform pap smears, such as family medicine clinics, not listed OBGYN clinics, and even to primary care clinics that do not perform pap smears, as a reminder to refer their patients to the appropriate clinic that can perform them.